Hi, thanks for joining me today. Today I'm going to be discussing why is it that so often blood pressure readings might be inaccurate. And I'll give you two great websites to check out. Some studies have been done that show when patients go to the doctors, the person taking the blood pressure reading might not be taking it accurately, might not be following the guidelines. And I've had my pressure taken many times over the last 40 years. And I personally feel that only on 2 occasions was my blood pressure taken according to guidelines and accurately. Now, I have a great handout you can look at that will show you the proper procedures to take your blood pressure at home. And this is the website, https://www.heart.org. And if you type this into the search box, monitoring your blood pressure at home, you will come to the article. Now, generally speaking, there are certain ways to take a blood pressure. I'm not a doctor, a nurse, or medical professional, but your feet should not be dangling, and they should not be putting the cuff over clothing, not over your sleeve, and they should be using the proper size cuff, and your arms should be at the right level. They shouldn't be chit-chatting, which they often do. And it's also important that you don't have a full bladder, because that can affect the reading, as well as alcohol or cigarettes, caffeine. So all these things can come into play. Now, for many years, I had been told that my blood pressure was rather low. And one day, a really amazing doctor discovered that the wrong size cuff had been used on my arm. And what had happened was they were using a standard size cuff, and I have a really small upper arm. And when a cuff is too large for your arm, it can result in a false low reading. And if a cuff is too small for your arm, it could give a false high reading. So all these things come into play. And some doctors might argue that individually these things aren't really a big deal, but if the person taking the blood pressure reading has what I call multiple violations, these points can add up. So if the person has you sitting in a chair with your legs dangling, they're talking to you, and your arm's not at the right level, and so forth, all these little points can add up enough to perhaps put you over the edge where it could appear that you have high blood pressure when you really don't. Now, something else that has come up, I know in 2017, the American Heart Association had put out some guidelines saying that if it was the first time that a patient had been to a doctor to get a blood pressure reading, the pressure should really be taken in both arms. The pressure can vary depending what arm you take it in. And if they found a significantly higher difference in one, that at subsequent visits, that office should be taking the reading in that arm that had the higher reading to begin with. I personally feel that both arms should be checked at all visits. So that's one of my pet peeves. Because if the pressure is significantly higher in one arm than the other, it could signify some health problems. For example, kidney problems, diabetes, clogged arteries, and so forth. So my personal opinion is they should always be doing that. And some studies show that one of the reasons they don't is due to trying to save a little bit of time. And I think patients are really being hurt by the readings not being taken properly. Now, another thing that could come up, some studies show that the person taking the blood pressure reading may not have been trained accurately or isn't quite confident enough if they're doing it correctly. As well, in one study, 50% of the doctors were not really sure. They said they really didn't have too much time to pay attention to that. Now, this is not to scare people. There are many fine doctors out there, many superb people taking great readings, but certainly there are things going on out there that need attention. The other aspect is the machine at your doctor's offices being validated? What I mean by that is it being checked for accuracy every so often as needed. And some studies show that this was not to be the case in some offices. So that's another issue that needs to be examined. We also get to the issue of if you're buying a monitor to check your pressure at home, how accurate is that monitor? And I have a really good website you can go to, and it lists machines that have been checked for accuracy, because in the United States you could have machines on the market that can be sold, but it doesn't necessarily mean they're accurate. And some other countries have taken great stride in making sure that these things on the market are accurate. I think Australia was one of the countries, but it's really important to make sure you know what you're doing when you're buying buying a monitor, and that you get a good one. And the website is https://www.validatebp.org. So you don't want to just pick one up off the shelf. And they often say, ask your doctor to see what they would say for a good monitor. And I tried that with my family doctor and some other doctors and my cardiologist as well. And none of them could guide me in that regard. So I had to do my own research, and I also consulted with a pharmacist because they can provide a wealth of information as well. Although you can't rely on them 100% to really know which ones are going to be the most accurate, but you've got to do your own research so you feel confident going in, you're getting one of the best ones that you can. And I would suggest, as well as often suggested by medical associations, to bring that monitor to your doctor's office and have it checked against theirs to see if there's any great discrepancy. My family doctor had me bring mine to the cardiologist, and unfortunately he didn't have much interest in it, thought it was a little bit silly, which quite surprised me, being it was a cardiology office. I had to bring it back to my family doctor, who took great interest and had a lot of patience in helping me properly assess it. And over time we realized that my monitor was most likely reading on average about 10 to 15 points lower than my pressure really was. So all these things come into play, and I highly suggest that you make yourself aware of what are the proper guidelines for taking a blood pressure reading. And when you are at your doctor's office or in a hospital or a clinic, if you feel that someone is not taking it accurately, speak up. And until enough patients speak up, these things are going to continue to happen. Now, there may be certain medical situations where a reading has to be taken a little bit differently than normal, especially if someone's bedridden, or maybe they have to have their pressure monitored while standing up and so forth. There can be certain medical situations, but another big issue is that of wrist monitors. Many dentists use these, and just last year I had a dentist put one on me and it was falling off my arm, and I said, I'm concerned with this. I know these monitors, generally speaking, are not as accurate. They can tend to read much higher than the ones that go over your arm, and a lot of that has to do with the anatomy of the wrist. So that's a whole nother thing that can happen. So if you feel that anything just doesn't seem right, speak up. Now, there may be some situations where a person is required to use a wrist monitor due to medical reasons, but we have got to be on the lookout for these types of things. And I know too many people with strokes or heart issues that have come up, so I take this very seriously. And it's another one of my pet peeves, how such inaccuracies are continue to happen day after day in these doctors' offices and medical establishments. So I hope these insights have helped you out, and I hope to see you next Friday. Bye.